Welcome to our lecture on pediatric neuroradiology. Today, we'll explore the specialized radiology branch focused on diagnosing and characterizing abnormalities in the nervous system, spine, head, and neck in children. Using advanced imaging techniques, we gain detailed insights into neurological strictures for accurate diagnosis and treatment planning. We'll cover key imaging modalities such as X-ray, ultrasound, CT, MRI, PET, and angiography, and advanced MRI techniques like MISS, DTI, FLAIR, SWI, DWI, PWI, tractography, NTI, and vessel wall imaging. Each offers unique diagnostic capabilities and applications. We'll highlight the role of these techniques in patient care, the importance of interdisciplinary collaboration, and the advancements in imaging technology enhancing our diagnostic and treatment abilities. By the end of this lecture, you'll understand the critical role of pediatric neuroradiology in modern medicine. Neuroradiology is a specialized radiology branch focused on diagnosing and characterizing abnormalities of the central and peripheral nervous systems, spine, and head and neck through advanced imaging techniques. It employs MRI, CT, PET, and angiography for detailed visualization of neurological strictures, facilitating accurate diagnosis. Neuroradiologists are vital in diagnosing neurological disorders, guiding treatment plans, and monitoring disease progression, ensuring optimal patient management. This field requires close collaboration with neurologists, neurosurgeons, and other specialists, providing comprehensive care for complex neurological conditions. Continuous advancements in imaging technology, such as functional MRI, diffusion tensor imaging, and neurointerventional procedures, significantly enhance diagnostic accuracy and therapeutic interventions. These innovations are pivotal in advancing patient care in neurology. Neuroradiology uses various imaging techniques to diagnose and treat neurological conditions. X-rays are a fundamental imaging modality used in neuroradiology for the following reasons: provides quick and accessible imaging for initial assessment of the skull, spine, and head. Essential for evaluating fractures, dislocations, and other skeletal injuries in cases of head and spinal trauma. Detects calcifications in the brain, which can be indicative of various pathologies such as tumors, infections, and vascular anomalies. Useful in diagnosing spinal alignment issues, vertebral fractures, and degenerative changes in the vertebrae. While valuable for assessing bone structures, X-rays offer limited detail for soft tissues and intracranial contents compared to more advanced modalities like CT and MRI. Pneumoencephalography is an obsolete, highly invasive imaging technique used to visualize the brain and ventricles. Key points: historical significance. Primary brain imaging method before CT and MRI. Technique: replaced cerebrospinal fluid with air/gas by lumbar puncture to visualize brain structures on X-ray. Applications: diagnosed brain tumors, hydrocephalus, and structural abnormalities. Invasiveness: painful, with risks including headaches, nausea, and neurological complications. Modern alternatives: superseded by safer, more accurate methods like CT, MRI, and ultrasound. Legacy: although no longer in use, it paved the way for the development of advanced neuroimaging techniques and contributed to the early understanding of brain anatomy and pathology. Ultrasound is a crucial tool in neuroimaging, especially for pediatric patients. It is safe and non-invasive, using sound waves instead of ionizing radiation. Its portability allows for bedside use, which is particularly beneficial in neonatal intensive care units. Ultrasound excels in neonatal brain imaging, providing clear views through the fontanelles. Doppler ultrasound further enhances its utility by evaluating blood flow and detecting vascular abnormalities. Additionally, ultrasound is invaluable for guiding procedures like lumbar punctures. Its cost-effectiveness compared to CT and MRI makes it an accessible option for routine checks and follow-ups. CT is a critical imaging modality in neuroradiology due to its ability to provide detailed cross-sectional images of the brain and spine. Key aspects include: offers high-resolution images of bone and soft tissue, making it ideal for detecting fractures, hemorrhages, and structural abnormalities. Essential in the rapid evaluation of acute stroke, differentiating between ischemic and hemorrhagic stroke, and guiding thrombolytic therapy decisions. Provides comprehensive imaging of head and spinal trauma, identifying fractures, hematomas, and contusions. Useful in identifying and characterizing brain and spinal tumors, guiding biopsy and treatment planning. When combined with contrast agents, CT angiography visualizes blood vessels, aiding in the diagnosis of aneurysms, arteriovenous malformations, and vascular stenosis. Limitations: although excellent for bone and acute hemorrhage, CT has low. MRI is essential in neuroradiology for detailed imaging of the brain, spine, and nervous system. Key features: superior soft tissue contrast, preferred for brain and spinal cord pathology. Multiplanar imaging captures images in multiple planes without patient repositioning. Functional imaging, advanced techniques like fMRI, DWI, and perfusion imaging assess brain activity and blood flow. Neurodegenerative diseases, diagnoses and monitors multiple sclerosis, Alzheimer's, and Parkinson's. Tumor evaluation, detailed imaging of tumors guides biopsy and treatment. Pediatric imaging assesses congenital anomalies and pediatric tumors. Limitations include less effectiveness for acute hemorrhage and bone fractures compared to CT, and contraindications for some implants. Magnetic resonance spectroscopy is an advanced MRI technique offering metabolic and chemical tissue information. Key aspects: metabolite analysis measures specific brain metabolites, aiding neurological diagnosis. Brain tumors differentiates tumor types, grades, and recurrence versus radiation necrosis. Neurodegenerative diseases assesses diseases like multiple sclerosis and Alzheimer's by detecting brain chemistry changes. Epilepsy identifies metabolic abnormalities in epileptogenic zones, aiding pre-surgical planning. Infections and inflammation distinguishes between infections and inflammatory conditions. Non-invasive provides biochemical information without invasive procedures. Limitations: complex interpretation, often complementary to conventional MRI, requiring expertise in acquisition and analysis. Diffusion tensor imaging, DTI, is an advanced MRI technique that provides detailed information about white matter tracts. Key aspects: white matter integrity measures water diffusion in white matter to assess tract integrity and organization. Traumatic brain injury, TBI, detects microstructural changes not visible on conventional MRI. Stroke maps affected white matter pathways for stroke assessment and recovery. Neurodegenerative diseases tracks white matter changes in multiple sclerosis, Alzheimer's, and Parkinson's. Brain development studies pediatric brain development and abnormalities. Surgical planning maps critical pathways for neurosurgical guidance. Research applications studies brain connectivity in neurological and psychiatric disorders. Limitations: requires advanced software and expertise. Sensitive to patient movement. V1-weighted imaging is a fundamental MRI technique that provides detailed anatomical information with high spatial resolution. Key aspects include: offers excellent contrast between different tissue types, particularly useful for visualizing the anatomy of the brain and spinal cord. Highly sensitive to fat, making it ideal for detecting fat-containing strictures and acute hemorrhage. Enhances visualization of pathology when used with gadolinium contrast agents, helping to identify tumors, inflammation, and blood-brain barrier disruptions. Preoperative planning provides precise anatomical details essential for surgical planning and navigation. Assessment of normal and pathologic anatomy differentiates between gray and white matter, identifies structural anomalies, and evaluates the brain's overall architecture. Limitations: less sensitive to certain types of pathology compared to T2-weighted and other advanced dye. The two-weighted imaging is a core MRI technique that excels in detecting pathological changes in tissue due to its high sensitivity to water content. Key aspects include: highly sensitive to changes in water content, making it ideal for detecting edema, inflammation, and other pathologic conditions. Excellent for visualizing lesions such as tumors, cysts, infarcts, and areas of demyelination due to its contrast between normal and abnormal tissue. Provides clear images of cerebrospinal fluid, aiding in the assessment of conditions like hydrocephalus and cystic lesions. Offers good differentiation between gray and white matter, which is useful in identifying various brain pathologies. Crucial for evaluating spinal cord abnormalities, including disc herniations, spinal stenosis, and intramedullary lesions. Can be affected by motion artifacts and has lower spatial resolution compared to T1-weighted imaging. May also be less effective for detecting acute hemorrhage. Proton density, PD, weighted imaging is an MRI technique that offers balanced T1 and T2 contrast for diagnostic insights. Key aspects: tissue contrast, visualizes gray and white matter structures effectively. Lesion detection, highlights subtle abnormalities, especially in white matter. Joint imaging, assesses cartilage and joint structures. Multiple sclerosis, detects brain and spinal cord lesions and EMs. Spinal imaging, identifies intervertebral disc pathology and spinal cord lesions. Limitations: lower overall contrast compared to T1 and T2 imaging, less effective for certain pathologies, and less sensitive to acute changes. The two-weighted imaging is an MRI sequence sensitive to magnetic susceptibility effects, valuable for detecting specific pathologies. Key aspects: hemorrhage detection. Identifies acute and chronic hemorrhages, microbleeds, and hemosiderin deposits. Vascular abnormalities. Detects arteriovenous malformations, AVMs, and cavernomas as areas of signal loss. Iron deposition. Identifies abnormal iron in neurodegenerative diseases and hemochromatosis. Trauma. Evaluates traumatic brain injury, TBI, detecting small hemorrhages and diffuse axonal injury, stroke. Assesses stroke, particularly hemorrhagic transformation and small infarcts. Tumor evaluation. Identifies hemorrhage, calcification, and vascular components in tumors. Limitations. Susceptible to artifacts from air tissue interfaces and metallic implants, requiring correlation with other sequences. FLAIR is a specialized MRI technique designed to suppress the signal from cerebrospinal fluid while enhancing the visibility of lesions. Key aspects include nullifies the high signal from CSF, allowing for better visualization of lesions adjacent to CSF-filled spaces, such as those in the brain's ventricles and subarachnoid space, particularly effective in detecting and characterizing lesions associated with multiple sclerosis, stroke, infections, and tumors. Due to its high sensitivity to changes in water content, enhances the visibility of white matter lesions, making it a crucial sequence for diagnosing demyelinating diseases and small vessel ischemic changes, improves the detection of edema and inflammatory processes by providing high contrast between normal and abnormal tissues, useful in pediatric neuroradiology for identifying congenital abnormalities and developmental susceptible to motion artifacts, and may have a longer acquisition time compared to other sequences. Susceptibility-weighted imaging, SWI, is an advanced MRI technique that utilizes magnetic susceptibility differences to detail blood, iron, and calcium content in tissues. Key aspects: microbleed detection. Sensitive to small hemorrhages and chronic microbleeds, essential for TBI detection. Vascular abnormalities. Visualizes venous structures and detects malformations like AVMs and cavernomas. Iron and calcium deposition. Identifies abnormal deposits, aiding in diagnosing neurodegenerative diseases. Stroke assessment. Detects hemorrhagic transformation and thrombus in cerebral veins. Tumor characterization. Evaluates tumors by identifying hemorrhage, calcification, and venous structures. Enhanced contrast. Provides superior contrast for detecting brain pathologies. Limitations. Complex susceptibility artifacts, longer acquisition times, and motion sensitivity. Diffusion-weighted imaging, DWI, is an MRI technique that measures water molecule diffusion in tissues, providing insights into tissue structure and pathology. Key aspects: acute stroke detection. Identifies areas of restricted diffusion for early ischemic stroke diagnosis. Tumor characterization. Differentiates tumor types by assessing lesion cellularity, infections and abscesses. Distinguishes abscesses, restricted diffusion, from other cystic lesions. White matter integrity. Evaluates white matter tracts in conditions like multiple sclerosis and TBI. Cerebral edema. Detects cytotoxic edema in acute pathologies. Pediatric applications. Diagnoses pediatric conditions like hypoxic ischemic injury. Limitations. Susceptible to artifacts near air tissue interfaces, and may require correlation with other imaging sequences and clinical findings. Perfusion-weighted imaging is an MRI technique that assesses cerebral blood flow and volume, aiding in the evaluation of brain perfusion. Key uses include: identifies regions of reduced blood flow in acute ischemic stroke, differentiates tumor types and grades by assessing perfusion, detects chronic ischemia, and evaluates cerebrovascular reserve, monitors changes in cerebral perfusion, complements other functional imaging techniques. Pediatric applications, diagnoses and manages pediatric conditions. Limitations include sensitivity to movement and the need for contrast agents, with complex interpretation often required. Tractography is an advanced imaging technique that maps white matter pathways in the brain using diffusion tensor imaging. Key aspects include: provides detailed visualization of white matter tracts, assessing integrity and organization. Essential for preoperative planning, helping avoid critical white matter pathways and minimize deficits. Evaluates white matter damage in stroke and traumatic brain injury, aiding in understanding deficits and recovery potential. Studies effects on white matter tracts in diseases like multiple sclerosis, Alzheimer's, and Parkinson's. Diagnoses and understands developmental disorders in pediatric patients by mapping abnormal white matter development. Enhances understanding of brain connectivity and network function, aiding research in cognitive neuroscience and psychiatric disorders. Tractography is complex and can be affected by crossing fibers, partial volume effects, and requires advanced post-processing techniques. Magnetization transfer imaging is an advanced MRI technique enhancing contrast based on the interaction between free water protons and macromolecular-bound protons. Key aspects include: improves contrast between normal and pathological tissues, detects and characterizes diseases like multiple sclerosis (MSS) by highlighting demyelinated regions, differentiates between tumor tissue and normal brain tissue, detects subtle changes in brain tissue composition not visible on conventional MRI, assesses cartilage and high macromolecular content tissues, enhances detection of lesions and abnormalities. Limitations: requires specialized protocols, longer acquisition times, and complex interpretation, often needing correlation with other imaging findings. Vessel wall imaging is an advanced MRI technique for evaluating blood vessel walls, providing critical insights into vascular health. Key aspects include: identifies atherosclerotic plaques, assessing composition, size, and thrombosis or embolism risk. Diagnoses and monitors vasculitis by detecting vessel wall thickening and enhancement. Details aneurysm wall integrity, crucial for rupture risk assessment and treatment planning. Identifies intramural hematomas, aiding in diagnosing acute aortic syndromes and vascular emergencies. Evaluates stroke risk by identifying vulnerable plaques and abnormalities in carotid and intracranial arteries. Non-invasive, avoiding risks of procedures like catheter angiography. Needs specialized protocols and high-resolution techniques. Interpretation can be complex and should be correlated with clinical findings and other imaging modalities. Positron emission tomography is a nuclear medicine imaging technique that detects gamma rays emitted by a radiotracer, providing functional information about tissues. Key aspects include: visualizes metabolic activity, essential in oncology for tumor detection and monitoring. Assesses brain metabolism in conditions like Alzheimer's, epilepsy, and Parkinson's disease. Highly sensitive for primary and metastatic tumors, complementing anatomical imaging. Evaluates myocardial perfusion and viability, aiding in coronary artery disease diagnosis. Utilizes various tracers, for example FDG, amyloid, to target specific metabolic processes. Aids cognitive neuroscience research by studying brain function and connectivity. Limitations: involves ionizing radiation and lower spatial resolution than MRI/CT, often combined with CT, PET/CT, or MRI, PET/MRI, for comprehensive imaging. Angiography visualizes blood vessels and organs, providing detailed vascular information. Key aspects include: offers detailed images of arteries, veins, and capillaries, essential for diagnosing and evaluating vascular diseases. Detects conditions like aneurysms, AVMs, stenosis, and vessel occlusions. Guides procedures such as angioplasty, stenting, embolization, and thrombectomy, improving outcomes. Identifies and treats vascular occlusions, aiding in reperfusion therapies. Includes MRA and CTA, providing detailed images without catheter insertion. Evaluates blood flow dynamics and perfusion. Invasive angiography risks include bleeding, infection, and nephropathy. Non-invasive methods may have resolution limitations compared to conventional angiography. In summary, we explored neuroradiology, focusing on advanced imaging techniques for pediatric neurological conditions. Discussed X-ray, ultrasound, CT, MRI, PET, and angiography applications in pediatric neuroradiology. Highlighted advanced MRI methods like MSS, DDI, FLAIR, SWI, DWI, PWI, tractography, NTI, and vessel wall imaging for detailed insights into brain and spinal pathologies. Emphasized these techniques' roles in stroke assessment, tumor characterization, white matter evaluation, and surgical planning. Stressed collaboration among specialists for comprehensive patient care. Noted each modality's limitations, including artifacts and the need for expertise. Continuous improvements promise better outcomes. Ongoing research will advance pediatric neurological care. Thank you for your attention.